Total shoulder replacement. We have to talk about two different types of shoulder replacements. On these x-rays here, on this side you see the anatomical total shoulder replacement, where we replace the ball and socket configuration as it naturally occurs in the shoulder joint. On this side you see what we call a reverse total shoulder replacement. The ball and socket configuration is turned around. Reason for this is that we use the reverse total shoulder replacement in patients who also suffer from chronic rotator cuff tear, which then has led to shoulder arthritis. We can only use an anatomical total shoulder replacement when we have intact rotator cuff tendons, which usually is a younger patient clientele. The reverse total shoulder replacement is a semi-constrained joint which assists the remaining rotator cuff tendons, usually at the front and the back. The top tendon is worn out and torn, plus the big deltoid muscle on the outside of the joint to help with range of motion in reverse total shoulder replacements. The most common reason for shoulder replacements are shoulder osteoarthritis, and chronic pain, especially at night, is the most common symptom that leads patients to come and see a doctor. In some patients, a massive rotator cuff tear, which can't be repaired, can also cause chronic pain next to inability to move the arm and stiffness of the joint. And depending on whether we have a primary osteoarthritis, which causes pain and stiffness, or rotator cuff tear arthritis, causing pain and stiffness due to chronic rotator cuff tendon tears, then lead to different types of shoulder replacement. The surgery for shoulder replacements is a standard procedure done under general anesthetic in the hospital, and most patients can leave the hospital on day one after surgery because most patients are still mobile. Rehabilitation can happen at a physiotherapist and at home, and sling immobilization is required for somewhere between 4 and 6 weeks, depending on the specific type of shoulder replacement that was used. A rehabilitation that includes physiotherapy and then exercise physiology with strength and resistance training will happen for somewhere between 6 and 9 months. But the initial symptoms of pain disappear quite quickly, and with the rehabilitation, a normal range of motion can be restored over time. On this side, you can see a model with a total shoulder replacement where we resurface the humeral head as well as the glenoid, which is the socket part of the shoulder blade. In fact, this is the implant that I prefer these days because it allows for very little bone resection. We call this a stemless implant with a ceramic head against a polyethylene button, which has a very low friction coefficient. On the other side, you see a model of a reverse total shoulder replacement where the ball and socket configuration is turned around. So the ball is fixed to the socket side, the glenoid, and the socket is fixed in the humerus. This turns the shoulder joint into a semi-constrained construct, and this is required for patients who suffer from chronic rotator cuff tears, which can't be repaired. In these cases, the specific configuration of the reverse total shoulder replacement helps the remaining rotator cuff tendons and the big deltoid muscle out here to move the shoulder.